Welcome to Peek a Pod, a podcast that inspires the young to think beyond the obvious. Close your eyes for 5 seconds. You now imagine that blur. That is a reality for thousands and millions of Indians today. A few years back, I had visited Dialogue of Dark. Definitely, that grew my empathy towards visually impaired and people who suffer from blindness. But that also gave me a quite privilege of understanding how important is a healthy eye. For the same reason, I bring you today's episode. Joining me is Dr. Rishi Mohan. He has been assisting eye surgeries for renowned names such as Atal Bihari Vajpayee and now treating very rare and specialized cases when it comes to eye surgery. Welcome to the podcast, sir.
Thank you so much. Thank you for having me.
So, sir, I wanted to start this podcast by understanding that how important is high health and how underestimated is high health in India.
It's a good question. I think the eye is the primary sense organ of the body. You'll be surprised to know that the inputs from the eyes comprise almost 80% of the entire brain's inputs. So the brain is getting inputs from the nose, the ears, the mouth, and the other parts of the body. But the eye just gives it so many terabytes of information that 80% of its processing power is essentially going towards looking after inputs coming from the eyes. So it's by far the primary sense organ, and therefore it's our responsibility in many ways to look after it. And so that's a very valid question and very, very applicable in today's age.
So, you mentioned it's a very important sense of organ. But why do people not go to an eye checkup or get an eye checkup very regularly? Is it because of the fear? Is it because lack of awareness? Is it because a lot of myths are there around? So what do you think is the major reason for this? And also what is the major reason people generally, get a sense of responsibility to eye only when they suffer a certain thing? So what is that reason behind?
So I think it's a multiple reasons for it. Some that you've already mentioned about awareness. Some because they're afraid that something might get picked up, and some is just neglect, unless there is a real problem. Also, the eye is a binocular organ, right? So if one eye is something going wrong, it is often missed because the good eye is covering for it. The other thing, I think nature gave the eyes a lot of extra privileges and made it a fairly self-sustained organ. And things don't go wrong, they do, but things generally are doing quite well in the eyes for most people.
Right. But sir, when we see today's youngster, we see that a lot of them, I mean, when I was in school, I did not see a lot of my classmates wearing lenses or wearing glasses. But today, if I see, if I visit a school, I see a lot of students wearing these glasses. I feel the number, how people take care of of their eyes, that has changed, or is it because of the AQI? Is it because of the lifestyle that we have adopted? Why is that so?
I think again it's a bit of both. There are environmental influences in us, and there are just what used to be lack of awareness. On average, about 40% of any class in school, the kids should be wearing glasses. But if you actually go and take a survey, it's much shorter than that, which means that many of them are being missed. And that's where the relevance of school eye health programs comes in, and how the kind of things that we go and just look at these children to see if they can pick up any such deficit. The environment, yes, near work has gone up a lot in the young children, and we know that progression of these powers is linked to the number of hours you spend on near work. Near work doesn't necessarily mean screen work. It could mean near reading work also. That also has a contribution to play. The near screens probably a bit more, but even reading work, and there are ample evidence now in terms of studies which have shown the link between children who spend more time outdoors and children who spend more time on books and reading screens and the onset and the progression of myopia.